Video stock is Profunda Brachii Artery. We'll study introduction, origin, course, branches, relations and clinical aspect of this artery. It is also called deep artery of the arm. It's the largest branch of brachial artery. It arises from posterolateral aspect of brachial artery just below the teres major and leaves the anterior compartment early. It runs along with radial nerve and supplies posterior compartment of arm. The course is it enters spiral groove along with radial nerve, passes between long and medial heads of triceps, then between lateral and medial heads of triceps, and ends by dividing into terminal branches which take part in elbow anastomosis. Branches are nutrient artery to humerus, muscular branches to three heads of triceps, deltoid branch, middle collateral artery or posterior descending branch, radial collateral artery or anterior descending branch. Relations are it is closely related to radial nerve in spiral groove, and in the fractures of mid-shaft humerus, radial nerve and profunda brachii artery both will be damaged.